episode of Africa Health Check.
I think the government should give priority to the healthcare issue.
We need a lot of the doctors.
We explore the key aspects of the Africa CDC's new public health order.
I think it's so important to build capacity within each country in sub-Saharan Africa to not be dependent on foreign doctors to come in.
And the potential benefits of its capacity building efforts in infrastructure and medical equipment. The new public health order for Africa, as outlined by the Africa Center for Disease Control and Prevention, is a strategic roadmap focused on sustainable health outcomes and health security, and it encompasses 5 essential pillars that we will unpack. On today's episode, we will be discussing Africa CDC's focus on building capacity in infrastructure and medical equipment. I am your host, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Marianne Mureithi, the chair in the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. But before we hear from our panelists, let us have a look at this episode's feature story.
Hi, my name is Deanna Saylor. I'm originally from the United States, but I've been living in Lusaka, Zambia for the past 6 years. And I'm a neurologist, and I do both clinical work as well as research. So I originally became interested in neurology through personal experience. My mom was actually diagnosed with multiple sclerosis, and just watching her battle with MS or multiple sclerosis inspired me to want to become a doctor and to specialize in neurology in particular. When I first came to Zambia and was beginning both the research program and the training program in neurology, the first thing that we realized we needed to do was understand what kinds of neurological disorders that we were encountering and also how our patients were doing with these disorders. And so we started a neuroepidemiologic study, which basically means looking at the patients that we were seeing, identifying what the cause of their illness was, and tracking what their outcomes were. Did they survive their hospitalization or not? If they did survive, did they have disability or not? And this really informed the research work that we've been doing and also how we trained our neurologists here in Zambia. So I came to set up this specialist training program, which launched in early 2018. And since that time, we've actually trained 9 neurologists, 7 adult neurologists and 2 pediatric neurologists. And even more exciting is we actually have 10 that are currently in training now and will be graduating within the next 2 years. So I was really blessed and lucky to have the opportunity to train at one of the top neurology departments in the world. And as a result of that, I was exposed to a wide array of patients, both locally from the Baltimore area where Johns Hopkins is located, but also who flew in from around the world for opinions from our senior doctors. I think making clinical mentorship and clinical bedside teaching and clinical reasoning the cornerstone of how we train our residents is really, really important, so that we make sure that our neurologists don't just have the book learning, they really have the practical learning of how to take the knowledge that they acquire from books and then apply it to the patient laying in the bed in front of them in order to make sure they have the correct diagnosis and treatment plans for those patients. And so I think that absolutely it's essential that Africa invests now in the infrastructure that's needed to care for critically ill patients, in training the healthcare workers that are going to be needed for learning a new disease disease, adapting to a new disease and taking care of patients with a new disease, and in the vaccine manufacturing capabilities, so that once that vaccine is developed, we're not waiting and at the end of the line for the vaccines that are manufactured in higher income settings. And so I think we learned a lot of lessons from COVID, and the biggest one from a medical perspective is that we can't wait until the next pandemic. That preparation starts now, and I think the initiatives to start to really invest in pandemic preparedness in both medical training, infrastructure, and vaccine manufacturing is essential to Africa's success when the next pandemic does come. Neurological disorders are common, and it's really important to have neurology specialists available in a country. But even on a broader aspect, I think it's so important to build capacity within each country in sub-Saharan Africa, to not be dependent on foreign doctors to come in, to not be dependent on sending physicians to foreign countries to train. We know that they often don't come back when that happens. And so I hope that people really think about investing in training in country to really develop specialists that know the local people, that know the local disorders, that know how to practice in the local healthcare setting, and can really make the greatest impact for patients, because that's what we're meant to do as doctors, is make sure we're doing everything possible to improve the lives of our patients. And then thinking more broadly, it's that same investment in training healthcare workers, quality training for healthcare workers, quality infrastructure, and vaccine manufacturing that's going to make sure that Africa is prepared for the next pandemic as well.
Thank you for joining us here at Africa Health Check, and we're going to jump right into it. So today we are talking about some of the infrastructural gaps in the African health systems generally. So maybe perhaps just to lay the foundation for this conversation, Dr. Marian, you can highlight some of the key infrastructural gaps that we see commonly in health systems across Africa.
Yes, thank you, Gigi, for having us once again. And yes, we do have gaps, and some of these gaps are well highlighted during the recent pandemic, and we keep seeing them recurring over and over again. And for me, one of the key gaps is lack. Can I just say lack? And then under that umbrella of lack,
yes,
we have lack of proper infrastructure. Would want to have very good structures, hospitals or dispensaries or clinics just next to a community. They don't have to travel very far. And if they have to travel very far, we have lack of good road infrastructure. So you find this patient, this pregnant woman has to use very unconventional methods to reach that very essential service. 3, can I talk about even health care providers? We are not training enough. I don't think we have enough doctors per patient ratio. That needs to be well balanced. We don't have enough nurses. We don't have enough community health workers. And it's a wake-up call. We need to strengthen our universities, encourage our next generation to find solutions in terms of healthcare providence to our communities. We lack proper or full kitted medical equipments. You know, we want to have enough x-rays that are well maintained. We want to be able to prescribe an MRI and the MRI or the magnetic imaging technique so that we can see what is really ailing you. For example, the PET scan, a fantastic machine that lights up your body, or images your body, and can spot a cancer forming. Many 2-3 years ago, Kenyans, for example, had to travel to India for this service, or South Africa, or Egypt. But I'm very happy to say now in Kenya we have 2 or 3 PET scanners. So we're making some progress there. So we need to have very good equipment, and not just have very good equipment, Gigi. We have to have this equipment serviced. We have to have this equipment maintained. And on top of that, we need people who know how to operate those machines. Can I give you a very funny and also sad story at the same time? In my country, we're really working hard to implement the universal health coverage. And our former president came into a very good collaboration with the private sector to fund each and every hospital, each and every county with medical equipment, good medical equipment. And at this moment, most of our county hospitals in far-flung areas have this equipment. But they forgot one thing. They forgot one, maintenance. Who is going to fund these machines needs maintenance every year. Two, they did not train personnel. So right now we have machines seated in a hospital that have never been used. And it saddens me. So as much as we want to fill in these gaps, identify them, we have to think 360 with different layers on the table. There are many other gaps, Gigi, I'd like to talk about, but I'll stop there so that we can just think through some of these key that I have pointed out.
Absolutely. You know, when you're talking about sometimes procuring the equipment, the machinery, but not training the personnel that's going to be utilizing that machinery, you're reminding me of this phenomena we have in my country. We often say that one of the biggest problems that we face in Africa is that we like to throw money at problems, you know. So if there's a problem, buy, procure, do something, you know, and we don't look at the entire supply chain. We don't look at the other supporting factors there, the maintenance, the capacity building, sometimes even the space of where are we going to put this machinery, you know. So all we want to do is just to focus on procurement, and then when it comes to accountability, we just tick off that box to say, yes, we did buy the equipment, yes, we bought the PPE, and that is our way of accounting or reporting. But in terms of the efficiency, the efficacy of some of these things that we get, we actually don't review or evaluate that. I don't know if you want to add on to that, Reverend.
Yes, what COVID-19 exposed in our healthcare delivery or healthcare system, it's like, I don't know whether to call it administrative imbalance in our healthcare services. Because what happened was that everything was shifted onto COVID, the vaccines, to the neglect of other health matters. I'll give examples. For instance, communicable diseases. When we talk about the three big killers or some of the challenges that Africa health in general face is malaria, tuberculosis, HIV. In fact, it's known that all children who die under 5 years, about 50% of them die because of pneumonia, because of measles, because of tuberculosis, malaria. And isn't it quite surprising that when COVID came, attention was moved away from that? That is a perfect imbalance. How about people with underlying problems? I mean, health issues, comorbidities, communicable, non-communicable diseases, heart problems, diabetes, cancers, chronic obstructive pulmonary diseases, and such. Everything was shifted. Even people who have hypertension and all this, they were afraid to go to hospitals. There were no attendants. There were no healthcare officials to attend to all these people. And people died. So when we're talking about gaps, probably our policymakers or those people up there who look at this need to think ahead that, okay, if this is what happened during the COVID times, we want to plug in. What are we going to do so that if another big pandemic happens, we are able to take care of communicable or non-communicable?
I totally understand you, and I hear your frustrations about that. But maybe to bring you in, Dr. Mary, and didn't the status quo for the last 3 years necessitate that COVID-19 is prioritized over other diseases?
Yes, and that's what we call pandemic preparedness, pandemic emergency care. We needed to shift some resources, shift a few of equipment, infrastructure, investments, and focus to COVID-19 as it should.
Should it be to the exclusion of other?
Should, at that point. But as Reverend has said, this is a lesson learned. As much as we are preparing for the next pandemic, you should have quite a resilient healthcare system that it can absorb any shock. Be it a pandemic, be it a natural disaster, be it, as I mentioned, at some point, a terrorist attack, for example. We should have a very resilient healthcare system that can absorb and withstand and still serve its people.
Yes.
Yes. So
Yeah.
as much as we're trying to, yes, we focused on one thing, but it's taught us a lesson.
Yes.
That let's build a pandemic kitty, but strengthen all the other structures so that they're not affected.
So that there's a balance.
Exactly.
Is there
So
such a country in Africa that could be cited as an example where responding to COVID-19 did not compromise that response or even the success that they've recorded in other public health matters?
Let me give you an example, Gigi. I think one of the success stories from COVID-19, in our opinion, as we sit with other different scientists, Africa has been facing outbreaks for many years.
Yeah.
COVID wasn't the first one.
Of course.
We had Ebola. We had dengue fever, yellow fever. And that had somehow started creating, first of all, a surveillance infrastructure, a disease detection infrastructure. We had people, we had a way to communicate. We had people on the ground already surveying carrying surveillance for other diseases.
Yes.
And I believe it's because of that structure built at that point, we were able to respond very quickly to COVID-19. Other countries and other developed countries actually lagged behind in terms of responding.
Yes.
But for us, one of our success stories, we were somehow prepared.
Yes.
And I can continue this conversation to talk about even our immune system. We didn't see quite a big number of deaths in Africa.
Yes.
And it's something to do
As
with
expected.
as expected.
Yes.
Because our immune system has been challenged by infections over and over again. So we somehow, on a personal note, built a bit of resilience.
Yes.
And also our structures, our systems had some resiliency because of other outbreaks. Yes, we need to strengthen them. We need to make sure that we can face multiple outbreaks, multiple pandemics without really affecting any other structures. Yeah,
absolutely.
So it's kudos to our governments, really.
Absolutely. I think we did really have commendable to a large extent. Of course, there are always gaps, there are always deficits, there are always where we could improve. And of course, even when we're talking in the context of Africa, there are some countries that had a bit of resistance and sort of heeded the call to COVID restrictions a little bit late. But to a larger extent, the response was extremely commendable, and the resilience was evidenced by having a much lower mortality rate than what the whole world expected, really. So I want us, after this break, to talk about the Africa CDC framework. But for now, we're going for a quick break and we will hear what the people on the streets of Africa had to say. Stay tuned.
COVID-19 has caused a lot of strain on a lot of people. Some have lost jobs, but what keeps us going is talking to our friends, communicating, and sorting the solutions that we need to move on.
Of course, it can never be enough. Can never be enough, but the government is trying here and there. Yeah, but everything is there, especially the testing centers. I believe we got testing centers, and they provide us with anything that we need to, in the form of a protection from our diseases like sexual transmitted diseases. Yeah.
Normal routine you see every now and then going around, not as help from anywhere, or you see somebody that will approach and say, I'm from government, that I'm creating an awareness of COVID or something of that nature. It did not take place. So that is why I said that I didn't say anything, and I didn't feel any impact that they really did anything.
Welcome back. You are still watching Africa Health Check, and today we are discussing infrastructural gaps in the African health system generally, and we identified a lot of those in the first half of the show. But now I want us to dive into a bit of what has been happening. We know that Africa CDC launched a framework that is dubbed New Public Health Order in Africa. So maybe to share a little bit about when was this framework launched, what is it about, and then when we can also get into the pillars and so on and so forth.
Yes, Gigi, this was a key moment for Africa CDC, Africa Response. And this was actually in response to COVID-19. It really had exposed a lot of countries on how weak we were in terms of preparing for emergencies, and also how to build proper structures or infrastructures to safeguard our health. So Africa CDC in 2021, following COVID and COVID-19 and the different measures that were sometimes hard to implement, came up with this framework. And for me, as I mentioned in the previous episode, it's like a roadmap. What do we need to have in place to make sure that the public is well protected, there's health security for all, and it is also equitable access for healthcare? So that's simply what this public new order is. And it addresses many challenges and many things that need to be in place, like a map. This needs to be here, followed by this, followed by this, for us to get to this equitable, universal healthcare coverage. So again, this public new order, I'm hoping, and I can see actually being implemented by many African countries, starting with Kenya, because we started looking at ourselves inwardly. How are we doing in terms of universal health coverage? How are we doing in terms of implementing some of these frameworks that have been put up by the Africa CDC?
Absolutely. And before the end of the show, I hope you could also speak to the African at an individual level. What does this framework mean, and how can they be part of its rollout or implementation at the national level, which is where we're supposed to start? Furthermore to that, I know that the framework encompasses 5 essential pillars. So maybe you could highlight some of those pillars, Reverend?
Yes, CDC has come to has put this together. Number one, they want to talk about, or they want to have increased infrastructure, and then they want also increased workforce. They're also talking about courting reliable and responsible partnerships.
And maybe to add, one pillar that I'm very passionate about, and I think I do it every day, that is research and innovation. They're encouraging our next generation, people out there. We want to be more innovative in terms of addressing some of these health challenges. For researchers, can we all research on ways to improve health? Not just at universities or research institutes, but all of us can contribute. We've been seeing over and over again in the Africa Health Check programs, innovators, researchers making a difference in their communities. The other thing is to make sure we are strengthening or building structures that are going to strengthen our governance and sustainability. I think we learned a lesson. We cannot be on the receiving end. We cannot always be the ones receiving donations. We have to find a way for sustainable financing, governance. Once we get all this equipment or medical supplies, we have structures in place to make sure that these are in place. So again, these are some of the pillars that form the framework of the new public health order. And again, as I mentioned, it's a work in progress.
It is.
To implement them.
It's a different story.
Yes, a different story. And now that we're in the era of innovations, technology, I'm pretty excited to see where the roadmap is taking us.
Absolutely. Thank you very much for that. And maybe just to conclude this episode, I'm going to just pick on the last 2 pillars, which is around domestic resource mobilization and also action-oriented partnerships. I think one of the things I absolutely admire is that in this framework, they didn't just say have partnerships or collaborations. They said action-oriented partnerships. So this framework is not just for the government or key stakeholders, but it's also speaking to us as Africans, as individuals within your sphere of influence. So maybe as your parting shot, you could just talk about what role can an individual play in their community within the spheres of influence to also amplify the agenda on health security and realizing UHC targets. Reverend.
Yes, I believe it's inviting the community to have something to do, to contribute to the whole project by donation, by whatever they can do to help it. One of those strategic partnerships that I think Africa CDC has is with this initiative by MasterCard Foundation, Save Lives and Livelihoods, where they are sponsoring, or they have sponsored the vaccination, availability of vaccines and vaccination, and then helping the vaccine production on the continent, which is a great initiative.
Absolutely. And even investing a lot in public education. One of the things that the Saving Lives and Livelihood initiative has heavily invested in is around public education. And you realize that almost in every episode, if not all episode, we are emphasizing that one of the key, at the foundation of improving public health outcomes is public education and raising awareness. Dr. Marianne.
Yes, you mentioned that, and I've remembered the last 2-3 years. We have a small initiative, myself with a group of people, where we go out there in the communities to educate teachers, because we feel teachers are our greatest educators. Teachers both at the primary, secondary levels, and we go and teach them about COVID-19 safety measures, and it's been such fun just educating an educator, because we believe if this educator is empowered, they'll be able to pass on the message of what we've been speaking about the last few seasons: washing hands, wearing masks, how to protect others and protect your loved ones. And that has been a great initiative that touches the heart of the community. And the teacher is one of the heartbeats of a community.
Of course.
The other initiative I've been recently been a part of at my place of work, we have this thing we're calling Center of Epidemic Preparedness Initiative, again formed from this network. We have come together as laboratories within Africa, where a laboratory in Ghana detects a new pathogen and quickly transmits this information to Kenya, to South Africa, to Ethiopia, all the way to the center, that's the CDC, to help us in diagnosing better, to help us detecting this infection better, and to treat it better. So again, at the grassroots, we have these initiatives. In the laboratories, we have these great initiatives. And also, I'm sure in the healthcare sector, in different sectors, there are great initiatives that are all under that umbrella of the Africa CDC framework to safeguard our lives and also our livelihoods.
Absolutely. Another thing that's coming to my mind as we're talking about this Africa CDC framework is how we also need to really work hard around domesticating some of these international commitments towards healthcare, towards human rights, because you realize that a lot of our countries may have made these commitments, but for as long as they're not institutionalized, they're not made into laws in our countries, it's very hard to hold our governments accountable for them. They just remain at the, we just leave them to the goodwill of whoever the leadership at that point is. So I think it's important to work on institutionalizing some of these frameworks, to make them statutes so that we can hold our leaders accountable for them, so that we can even provide financing for them, so that we can provide sufficient capacity to ensure that some of these commitments are actually implemented or enforced at a country level. And I know that'll make your life much easier as a practitioner.
Oh yes, indeed. To have all these policies and frameworks in place. One that came into my mind, and I always tell my students, there's a policy by the year 2030. We should have a HIV vaccine readily available for the African continent. But what are we doing to get to that 2030 initiative? I don't know. So again,
it just remains a target.
Target. There's when you look at tuberculosis, there's also a 2025 initiative.
Yes,
we
2030
have
target.
Very good policies in place out there, but they need to be domesticated
at the national level.
Indeed.
Absolutely.
And a country that's doing it very well is India. India is working towards eliminating TB, and they have a framework. And I've watched their President Modi, come in on TV, just talk about TB. And creating that awareness. And I thought, you know what? This is what we need.
And that's how you also know that this is high on the political agenda, which is something that you have often said many, many times.
I believe CDC as backbone is the AU, isn't it? Yes, and AU comprises all the governments, all the nations of the continent. So then domesticating or bringing it to the local place is actually the duty of individual governments. But then there is a relationship right there that anything happening here, any good thing happening here, we can forward it to the other countries or to the AU for dissemination to all the other nations.
Absolutely. And
otherwise, CDC is powerless without member countries enforcing these initiatives that they have put out.
Absolutely. And that is also a role that we as individuals can play. Advocacy, influencing, you know, we can never run out of enough health activists and advocates. It shouldn't just be the job of the medical practitioners or the patients, or for you to wait for it to hit home. That's when you should care about raising awareness about the importance of domesticating some of these commitments in order to produce much better public health outcomes for our countries. But thank you very much for that fruitful conversation. And I hope you have been challenged to actually stand up and do something to lend your voice towards universal health coverage in Africa. Before we wrap up the show today, let's take a look at our African health champion for this episode.
Umra Omar, a Kenyan humanitarian and community conservation strategist, has emerged as an inspiration in Kenya's remote coastal regions. Her non-profit, Safari Doctors, defies geographical challenges, providing vital medical care and health education to the Bajuni and Awia communities in Lamu. With a degree in neuroscience and psychology from Oberlin, Umbra's journey led her from a career in Washington, D.C. back to her homeland. Witnessing a neglected medical aid project along the Kenya-Somali border, she founded Safari Doctors, delivering free medical services, empowering youth with health education, and fostering women's civic engagement. Umra's impact has been internationally recognized. Her journey remains a testament to resilience, compassion, and transformation.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.